Most runners either don't think about first aid at all or they way overthink it. And both of these can be a problem because when something goes wrong out there, you're all on your own, but you don't want to overcomplicate it either. Welcome to the UltraNurse Podcast. This is where we run long and work even longer. I'm Brad, a flight nurse, paramedic, dad of 3, and a mid-of-the-pack ultra runner, just trying to figure this whole endurance thing out 1 mile at a time. This podcast is about running, especially long, all while balancing work, family, and everything else that comes with real life. All right, people, I've been away for a week. I've been super busy. Actually, I haven't been running. I don't want to start it off negative, but this heel is a problem. I need everybody to pray for it. Actually, don't pray for that. There's enough going on in the world. This is first world problems. Small, it's stupid, but if you can run out there pain-free, man, take every advantage of it. So I don't even know. It's been 6 weeks. I've seen a podiatrist. I've been to PT a couple times. I can't get any diagnosis to what's going on here. I could run for an hour or two pain-free, feeling great, and then it'll just start to ache my heel and ache and ache and ache. Or I'll finish, I won't feel it all, and I'll get home, and then all of a sudden it feels like I got a blowtorch on the outside of my heel. It is just absolutely so frustrating. There's nothing, and it's not getting any worse anymore, but it's not getting any better. I've ran 14 miles this week. This is turning into a total disaster. And I did a little cross training, but like if I can't get some improvement in the next week or two, I'm going to cancel my Ure training my Ure 100 in the summer, which I don't really want to do. I put a ton of time, effort, money, and energy into this, and was really looking forward to it. But that's just a run that I'm not willing to go out and wing, and it'd be almost next to impossible just to not train accordingly, especially living at sea level in Iowa. And so I don't know, whatever. We'll see where it goes. All I could do is control what I can do and control my mindset, but it's getting pretty daunting. Anyways, that's where I'm at. And then I don't know. I've just been, it's been kind of down in the dumps, man. It's just the weather, and between that and the weather and just being busy at work and anyways, we're on the up and up though. I'm not going to air out any more of my dirty laundry here. Hey, I tell you what though, if you didn't catch last week's episode with Steve Huffine, go give that a listen to. Dude, awesome dude. Go follow him at Ultrafine Running on Instagram. I mean, just a salt of the earth dude, hell of a runner. And it was just a great conversation. It was only about 35 minutes long, but yeah, it was great conversation. I could have talked to him for 8 hours, and I hope to have him back on the show in a few months. And yeah, go give it a listen to, go give him a follow. But anyways, so on to this episode. Here's what I want to talk about, because I was recently on a coaching call with the group I'm coached by, Everyday Ultra. They got some great coaches there. Go give them a look if you're looking for coaching. And somebody asked a question about first aid, and it kind of drew me in because, one, I've been in EMS and the world of EMS and emergency medicine and critical care and transport for like the past 15 years, be that a paramedic or a flight nurse, or working in the ER. But so, and you know, I also spend a lot of time in the middle of nowhere running, and I've completed, a couple 100-mile ultra marathons, some, 50 milers, 100Ks, and some other ultra marathons. And so, I wanted to give people my perspective of first aid, and big in bold letters here. This is not medical advice. All right. This is not medical advice. Don't listen to anything I say. I don't know what the hell I'm talking about. No, but this is not professional medical advice to cover my butt here. Anyways, so what actually happens out? Let's get real about what we're dealing with in ultra marathons. So the big stuff people worry about, it almost never happens. Like, okay, like it almost big stuff that you worry about in life. And even in my job as a flight nurse, the big stuff we worry about, I worry about somebody like, number one, I don't want anybody to go into cardiac arrest. That's like the worst. That's dead, right? The amount of times that I've had somebody go into cardiac arrest in my helicopter, I can count on one hand in 9, almost 10 years now. And because that's my main goal. My main goal when I put somebody in the aircraft is like, okay, number one goal is not to have them go into cardiac arrest. That's my number one goal. Pretty, knock on wood, pretty good at achieving that goal. But like when the big stuff you worry about, again, it almost never happens. So in ultra marathons and running, what actually happens is this stuff. Okay. I wrote a little list here. Brad's top 10, and I don't know if it's 10 here, but I was just doing a game show because I don't have any like movie quotes today. So I was going to do like a game show quote, whatever. I know everybody stopped listening after that. Anyways, here's what actually happens. Blisters, skin breakdown / chafing, dehydration, and the next one I wrote down was electrolyte imbalance. Those two go hand in hand, right? GI issues, fatigue, weather exposure. That's it. We're not running a trauma bay out there, and we're not managing sickness and illness. We're not. We're managing ourselves, right? And we're trying to manage ourselves or the people we're crewing long enough to stay safe and to keep moving. That is the top priority. Okay? So, the goal of first aid in an ultra, all right? This is what I wrote down here. When I sit back as a paramedic and a nurse, and my goal is to not fix everything. And hey, I tell you what, when I'm in a helicopter or in an ambulance or in an ER room, I'm still not trying to fix everything. I know hopefully my employers aren't listening. Hopefully some of my patients aren't listening. But no, really, my goal is not to fix everything. That is not the environment. That is not the setting to fix everything. All right? The goal in the ER is to stabilize, to prevent life-threatening illnesses and injuries, right? The goal in my ambulance is to not let anybody get in any worse condition and to correct any life-threatening conditions. Same in the helicopter, right? The goal in an ultramarathon, to me, these are my opinions now, is number one, stay safe, right? And nobody here is going to stay safe because we're all going to run out the lightning and in whatever weather throws at us, right? And no, but seriously, stay safe. Number two is stay functional because, right? And number three, sometimes you need to buy yourself time. That's it. Just like in EMS, we stabilize, we transport. EMS is stabilize and transport, and ultramarathons, you stabilize and you move. It's like hand in hand. It really is. It's great. So now moving on, I'm going to give you what I actually carry. Okay. It's minimal, but it's purposeful, right? So what I don't carry a first aid kit in a traditional sense. I don't even think I pack one in my bin that my dad managed. My dad is my crew chief. Big shout out to my dad. He is the best. He got me into this damn sport, so he's not the best. No, but he is the best. He always crews me on my big, long endeavors. So, but anyways, I don't have like a big, complex first aid kit there. I think I have a couple Band-Aids in there, but they're for my nipples. For the shit. Y'all know what I'm talking about, dudes. No, but seriously, I don't carry a first aid kit in a traditional sense. It's a problem management kit. That's what I put together, right? And in my kit, I get a small Tupperware bin with inside my bin. And if I have a problem, that's what I grab. All right. So in my problem management kit, I have KT tape, Leuko tape, trauma scissors just to cut shit. I think a tweezers, a needle. I'll get to that later. And I think a tweezers, some lube. And I think that's about it. All right. The other part to my management kit is, and this is going into what I actually carry, is a phone, a headlamp, electrolytes, nutrition, and a little lube. That's it. Because those things right there are going to solve most of your problems, even before they start. All right. So the real first aid in the ultra marathon is prevention. I know people ain't going to want to hear that. People ain't going to want to hear that. But that is your best friend, your best first aid kit is prevention. Blisters just don't show up out of nowhere. Bro, sisters and brothers, I've learned this the hard way. When something is getting hot, address it. It's not going to get any better. It's not going to go away. When you start feeling a hot spot on your foot, if you don't want a blister, you need to sit down and put something on it, lube in your pack or whatever, put a little lube on it, or get to the next aid station and address that spot. All right. Blisters just don't show up out of nowhere. That goes for the same. Dehydration just doesn't appear. Like, you screw that up. You're not drinking enough, right? And most problems out there are predictable. And if they're predictable, they're preventable. All right. So situations that actually matter, real scenarios. Okay. Because this is where first aid, and quote, matters. Okay. You're deep in the race, something feels off. Could be dizziness, nausea, weakness, confusion, right? So your first move, and now we're way off the path of what to put back in a first aid kit, but I'm talking about first aid right now. Slow down, assess, and the biggest one is don't panic. Because if something feels off, like, oh, I'm dizzy, oh my gosh, there's nothing you can put in a first aid kit to solve that. You're not putting meclizine in there. Nausea, what are you going to put Zofran in there? Weakness, you can't do an IV. You can't, confusion. I mean, most of the time when you're feeling those symptoms of dizziness, nausea, weakness, confusion, it's either fueling, hydration, or electrolytes. Okay? Fueling, hydration, or electrolytes. That's a whole nother episode in itself. So fix those basics first, right? When's the last time you ate? What were you taking in for carbs per hour? Have you not eaten in 2 hours? Then eat. You need to shove some food down. if you're nauseous or whatever, I don't know, maybe your electrolytes are off. If you're dizzy, maybe you need some sodium. Take some electrolytes. All right? If you're hot, dry, burning up, drink. All right, scenario 2, you're cold, wet, and slowing down. This is the one where people underestimate, because exposure creeps up super fast. I've gotten cold before. It sucks. You get cold, tired, mentally foggy. All right. That could spiral. What you do in that is nothing in your first aid kit's going to fix that, right? You got to keep moving. You got to get to the next point, and don't stop and sit too long. Warm up by the fire for 5 minutes, but you can't stay there. You got to get out of there. Put some warm clothes on, get out of there. All right. You're alone, moving. Something goes wrong, right? You roll an ankle or God forbid you break a foot, whatever. What are you going to pack in your first aid kit? Nothing's going to help you in that scenario. But what's going to help you is your phone. That's your lifeline. If something goes sideways, you got to call, you got to share your location, and hopefully you're not waiting too long. But what are you going to do? You can't pack a splint. You know what I mean? Well, in like, as far as bandages go, like I said before, I pack a couple Band-Aids, because if you fall and you're bleeding, who cares? You're not going to bleed out. You are not going to bleed out from a fall on a trail. And everybody thinks like, oh, we got to get this clean. We got to put triple antibiotic on it. It's going to get infected. I'm going to lose a leg. No, it's not. It's you probably won't even get infected. It's just dirt. If you're running on the road and you're freaking, yeah, that's gross. But if you're out trail running, well, dirt don't hurt. Don't fall in like a pond or something. That's when you might want to clean it out as soon as possible, like at the next aid station. Anyways, yeah. So I'm back on track there. Yeah, I don't know. Medications. Let's move on to medications because I got lost there. I know I suck at podcasting, but this is what I really wanted to focus on. I really wanted to focus on medications because that's always intrigued me, as these pharmacokinetics And I did like pharmacology, and I still do like learning about pharmacology because I don't know everything. But I'm just going to be straight with you. I'm not a fan of using any medications in ultramarathons. I'm just not. I am just not. Though your body is a complicated machine and it works different. You're in overdrive and your body's working differently in these ultramarathons. And I'm gonna go over a couple of these medications. And the first one being NSAIDs, like ibuprofen, Advil. People that still use these, you should never, and I mean ever, ever use an NSAID in an ultramarathon. Okay, going back, the reason why people use them, one is pain reliever, and two, it is an anti-inflammatory. So people are like, oh, I killed two birds with one stone because I'm going to be inflamed and I'm going to be in pain. But NSAIDs also reduce blood flow to the kidneys. That's the major thing. They reduce blood flow to the kidneys, and during an ultramarathon, you are already stressing those kidneys. So you do not want to do that. You are an extreme risk. You're at I shouldn't say extreme, but you are at a far greater risk for suffering acute kidney injury when you're taking an NSAID on a 100-miler. Never, ever do it, especially when you're dehydrated. So I would never, ever recommend using an NSAID during an ultramarathon. Ever. You're going to stack on more stress. It's just not smart. It should be non-negotiable. Don't bring it anywhere near your pack or your drop bag, or even like the day or two after. I would not take it. I'm not a fan of them anyways. Plus they're hard on your gut and just GI issues and whatnot. And I'm just not a fan. If you got an injury in the acute phase or whatever, you roll an ankle, I guess I'm still not a fan of it. Don't pack it. Do not bring it to your ultramarathon. That's non-negotiable. Don't ever tell me you're taking an NSAID during an ultramarathon. I will not be your friend. All right. Now, another one people like to put in their packs too, that what I see or their drop bags, is Benadryl. I don't like this one either. I don't. People think that they get stung by a bee. Oh my gosh, I need to take some Benadryl so it doesn't sting and itch and whatnot. You know what? Benadryl, side effects of Benadryl are drowsiness, slowed reaction time, mental fog. And a lot of times you're already in a fatigue state. You don't want that. If you're having an allergic reaction, like a true allergic reaction, you need an EpiPen. That Benadryl is not going to stop. Benadryl does not stop anaphylaxis. Doesn't do anything for it. You need epinephrine. Sorry, hate to break it to you. I know Benadryl makes you feel safe and comfortable, if you get into a bunch of hornets or whatever. Oh, God, that's nightmare feel. But no, I guess if you're having an allergic reaction, you could throw a little Benadryl at it, but you need epinephrine. So I'm not a fan of Benadryl either. If you get stung by a bee and you're not allergic and it's getting red and itchy or whatever, just deal with it. That's my professional opinion. I'm not a fan of Benadryl. Moving on, Tylenol. Even this I'm cautious with because it masks pain, and pain's information. I know you're just trying to get over the hump, but it can be taxing on your liver. All right. That's my thing with Tylenol. I'm gonna admit I've taken it during one of my ultras, and I don't know if it worked or not. It was already past the point. So, anyways, I'm not a fan of Tylenol either. It can be hard on your liver. Got a lot of blood going through there. Yada, yada, yada. I'm just not a big medication guy in general. And even this one, I don't take it. And Zofran can get used a lot too. And it can help nausea. And everybody thinks, oh, I'm going to take it as Zofran, I'm going to be okay. The thing about Zofran is, and from what I've witnessed by giving it to patients for the past 15 years, is that once you're nauseous and once you're already throwing up, Zofran works like shit. Seriously, it does. You take Zofran like when you're just starting to get nauseous, and then it might work, but it's not perfect. And there's downsides to Zofran too. Super rare cardiovascular effects or QT prolonged. Yeah, I'm not even going to go down it, and it could cause constipation. I guess it has its pace, but I'm just telling you right now that if you're already throwing up, it does not work well. And So what's the point? I mean, you're just going to have to reset. I found out when I'm throwing up, usually it just goes away in a half hour or an hour. So just you do one of them resets, whatever, or try to shove down some food and your gut resets. But Zofran gets used a lot. Not a fan of it either. When it comes down to pain, I know some people, I can't think of the name of it. There's some spray on stuff. Joe from Everyday Ultra was saying about it. I want to actually give it a try, but you also have to remember, take a look what's in that shit, because remember, your skin is your biggest organ. So I'm always just like, hey, if this is a medication, look what's in it, read how it actually works, and you decide if you want to put that in your body or if not. The thing is that your body, again, the bottom line on medications, your body is already going through extreme stress, and everything you take adds another layer. If your doctor's told you to use something, it's a different story. Follow your doctor's orders, but usually using meds and ultras, I would be extremely cautious. That's just my take on it. Not a fan of it. All right. And again, alternatives, instead of using meds, you adjust your pace, you adjust your fueling, use electrolytes, take time just to reset. Sometimes you just need to sit down for like 20 minutes, do a reset, especially for gut issues, okay? Again, some people use topical layers like spray on stuff, lower risk. If it helps, great. But just remember, you're going to hurt. It's going to hurt. Anytime you run 100 miles, you're going to hurt, okay? So be mindful of what you're putting on and in your body, all right? Now, it pertains to first aid, the biggest safety tool you have, it's not your gear, it's not your kit, it's your awareness. It really is. It's your self-awareness and situational awareness, all right? It's knowing when to slow down, it's knowing when to adjust, it's knowing when to ask for help. That's what keeps you safe, all right? So again, I know you're like, oh, Brad was going to tell me what I need to pack in my first aid kit. Again, I don't think you need a massive first aid kit. I don't have hardly any bandages. If you fall on a trail and you're at risk of bleeding out, you have bigger problems, homeboy. So I don't carry any. I don't know if I even carry any triple antibiotic. I might have it in there, but it's probably expired. And I might have put it in there just to use between my butt cheeks for lube or something. I don't know. Too much information. But no, seriously. Like, I barely have any bandages. I don't have any medications in my kit. I have a couple Band-Aids. I have KT tape for toes and maybe a heel. I have Leuko tape for the bottom of my feet and maybe the heels. I have anti-chafing sticks and lube, and I think that's about it for like personal first aid. I believe that's it. And maybe I don't even carry sunscreen because I use arm sleeves and UHF stuff now because I'm off my rocker and I just don't like sunscreen. So I wear hats and just clothing now. So I'm pretty sure I do have Desitin in there for the chafing between the butt cheeks. Try it. Desitin's wonderful for that. Okay? I know, too much information. Ultra running's gross. But that's my first aid kit, folks. Oh, let me go back. I carry a trauma shears in there to cut tape and whatever. If I have crap going on with clothing or a pack or whatever, I got a scissors. I have a tweezers to pull something out or fix a nail or something. I got a nail clippers just in case you need to trim a nail or whatever. And I do have a needle. I put an IV needle in there, and because, all right, shut your ears off if you work in the medical profession, because I would fail every medical exam out there that I've taken because I pop blisters on myself anyways. I would never pop them on any other individual. But I do pop blisters. Dr. Hahn, if you're listening out there, popped a blister on my foot, the last one. I don't know. That works for me. I pop it. Don't pull the skin off. You pop it and you tape it. That's it. But I know other people where they just throw a piece of Leuko tape over it and they don't pop it. And that's fine. Figure out what you need to do. But that's what is in my first aid kit. Super small. I don't carry really anything in my pack other than lube. That's it. So, the key takeaway is you don't need a massive first aid kit, in my opinion. You need awareness, you need preparation, and you need good decision making good decision making, okay? And the ability to stay calm when things don't go as planned. Okay? So the key takeaway here is you're not out there to fix everything. All right? You're out there just to manage yourself, try to stay safe, and to keep moving. Keep moving. All right? I hope that helps somebody. I hope that actually I hope it gives people a more sense of kind of, I don't know how to describe it, calm or reassurance. Because I know how daunting it could feel, like packing, especially if it's for your first ultra or for your first 100 or even your first 50K. You're like, oh my gosh, I need to bring this just in case of this, just in case of that. If you fall and you scrape your knee and you want a Band-Aid, somebody's gonna have something at the aid station. You don't need to pack it. Seriously, I know I should stop talking because somebody's gonna be like, oh my God, Brad said this, Brad said that. But no, seriously, don't overcomplicate it. It's just putting one foot in front of the other. Just make sure you have your fuel, your electrolytes, your hydration, your blister care, your stuff for environment, warm clothes if it's going to be cold, a rain jacket, and foot care. All right? Otherwise, you're going to be fine. Trust me. I hope that brings people some reassurance out there. All right. I'm going to wrap it up for today. I know it's kind of a crappy episode. And we're going to try bringing more guests on the podcast. That's what I want to say. If yourself or anybody you know wants to be part of this podcast and wants to sit on here for a conversation, do reach out to me. I'd love to have you on here. And again, thanks for all your love and support. And go give the last episode a listen to as well. Like I said in the first part, Steve Huffine, great conversation with him. And I appreciate everybody spending part of your run, drive, or shift with me. And if this episode has helped you out in any way, share it with another runner. And make sure you're subscribed to the show so you don't miss the next episode. And if you got time, leave a rating or comment. I appreciate the heck out of everybody being here. And have a happy Easter. Have a happy Easter. And go rip some miles. All right, peace out.